Good morning, everyone, and thank you for being here today. I'm pleased to welcome you to this presentation on root cause analysis, or RCA. Today, we'll explore a regulatory-compliant approach to effective problem-solving that can really make a difference in our work. We'll cover the fundamentals of RCA, its importance in our industry, and practical strategies to implement it successfully. So, let's get started and see how this method can help us improve our processes and ensure compliance. Let's take a closer look at the purpose of root cause analysis, or RCA. The main goal here is to identify the true underlying cause of deviations, failures, or nonconformities that we encounter. It's not just about addressing the surface issue, but really digging deep to find what's causing it in the first place. By doing so, we can prevent these issues from recurring in the future through effective corrective and preventive actions, or CAPA. This proactive approach helps us not only fix problems, but also stop them from happening again. Another key point is that RCA helps us improve product quality, safety, and compliance. When we understand the root causes, we can make targeted improvements that ensure our products are safe for patients and meet all regulatory standards. RCA also supports data-driven decision-making. Instead of relying on guesswork or assumptions, we base our actions on solid evidence and analysis, which leads to better decisions overall. Finally, conducting thorough root cause analyses strengthens our pharmaceutical quality system, or PQS. It's about building a robust framework that promotes continuous improvement, consistency, and high-quality outcomes across all our processes. So, in essence, RCA is a critical tool that helps us improve everything from product quality to our overall quality management system, ensuring we meet our goals and maintain trust with our stakeholders. Let's talk about when a root cause analysis, or RCA, is actually required. First, whenever we encounter deviations or nonconformances, it's a clear sign that something isn't aligning with our standards, and RCA can help us identify the underlying issue. Next, out-of-specification or out-of-trend results are critical indicators that something has gone off track, and investigating these results is essential to prevent future problems. Market complaints or product defects also signal that there might be a deeper root cause that needs to be addressed to ensure customer satisfaction and safety. Batch failures or rejections are another key trigger. If a batch doesn't meet quality standards, RCA helps us understand what caused the failure. Environmental monitoring excursions, like unexpected changes in temperature or contamination levels, also require investigation to maintain a controlled environment. Equipment or instrument failures are obvious signs that something technical needs a closer look, and conducting an RCA can prevent recurrence. Audit findings, whether from internal reviews, external inspections, or regulatory audits, often point to systemic issues that need resolution. Data integrity issues, such as discrepancies or inconsistencies in our records, are critical and must be thoroughly explored to uphold compliance. Lastly, trend-based signals that indicate potential risks, even if they haven't yet resulted in a deviation, should prompt us to perform an RCA proactively. Overall, these situations are key moments where RCA helps us not just fix problems, but understand and address their root causes, ultimately supporting continuous improvement and compliance. When conducting a root cause analysis, it's essential to investigate what actually happened, why it happened, and most importantly, how we can prevent it from happening again. The focus should always be on understanding the process itself, rather than pointing fingers at individuals. Remember, a blame culture doesn't lead to improvements. It hinders learning and progress. Using structured, documented, and logical methods ensures that our investigation is thorough and consistent. It's about building a solid case based on facts, so validating our findings with evidence, data, and reliable information is crucial. An effective RCA approach is inherently cross-functional, meaning we need input from different teams and areas to get the full picture. This broad perspective helps us identify systemic issues rather than just addressing surface-level symptoms. Ultimately, the goal is to look beyond immediate causes and dig into underlying systemic problems. This way, we can implement solutions that truly prevent recurrence, leading to a more robust and resilient process overall. Let's take a closer look at some of the common root cause categories that can impact quality. First, we have the man or people category, which often involves training gaps or competency issues. If team members aren't properly trained or lack the necessary skills, mistakes can happen. Next is machine or equipment. Malfunctions or inadequate maintenance can lead to production issues or defects. Then there's the method or procedure side, where inadequate or unclear standard operating procedures can cause confusion and inconsistencies. Materials are also a critical factor. Variability in raw materials, issues with suppliers, or contamination can all compromise quality. The environment plays a role too. Factors like temperature, humidity, or the specific conditions of the area where the process occurs can affect outcomes. Measurement is another key category. Instrument errors or calibration problems can lead us to incorrect readings or assessments. Finally, the management or system aspect includes weak quality management systems or insufficient oversight, which can allow problems to go unnoticed or unresolved. Connecting all these points, it's clear that understanding these root cause categories helps us identify where to focus our improvement efforts, ultimately supporting a stronger quality culture across the entire process. Let's take a closer look at some of the key tools we have for root cause analysis. First up is the 5 why analysis. This is a simple yet powerful technique where you ask, why? 5 times to drill down to the root cause of a problem. It helps uncover underlying issues that might not be immediately obvious. Next, we have the fishbone or Ishikawa diagram. This visual tool helps us categorize potential causes of a problem, like people, processes, materials, or equipment. It's especially useful when dealing with complex issues that have multiple contributing factors. Then there's fault tree analysis, or FTA. This is a more structured, logical approach that maps out the pathways leading to a failure. It's particularly valuable for safety-critical systems where understanding all possible failure modes is essential. We also have is-not analysis. This technique helps us narrow down causes by comparing what is happening versus what should be happening, eliminating possibilities step by step. Pareto analysis, based on the 80-20 rule, guides us to focus on the few causes that are responsible for most of the problems. It's an efficient way to prioritize our efforts. FMEA linkage is another important tool. It allows us to evaluate potential failure modes before they happen, assessing their impact and likelihood to prevent issues proactively. Finally, process mapping and flowcharts give us a visual overview of processes, helping us identify bottlenecks, redundancies, or points of failure. Remember, each of these tools should be chosen thoughtfully, based on the complexity and impact of the issue we're addressing. Not every problem requires the same level of analysis. It's about selecting the right tool for the right situation to find effective solutions. Let's walk through the RCA workflow, which is essential for effective problem-solving and continuous improvement. It starts with problem identification and definition, where we clearly understand what the issue is and its impact. Next is initial containment, which involves taking temporary actions to prevent the problem from worsening while we dig deeper. Then we move on to data and evidence collection, gathering all relevant information to support our investigation. Using RCA tools, we conduct a thorough root cause investigation to uncover underlying causes, not just surface issues. Once we identify the true root cause, we can propose targeted corrective and preventive actions, or CAPA, to address the problem and prevent recurrence. It's important to perform a risk assessment according to ICH Q9 standards to evaluate potential impacts and prioritize actions accordingly. After implementing the CAPA, we document everything carefully, ensuring transparency and compliance. Then, we verify the effectiveness of these actions to confirm that the problem has truly been resolved. Finally, we close the event and trend it over time, which helps us identify patterns and continuously improve our processes. This entire workflow aligns with our overall theme of proactive quality management and continuous improvement, ensuring that issues are not just fixed temporarily, but systematically addressed for long-term success. Let's talk about what makes a clear and precise problem statement. First, we need to specify what exactly happened. This means describing the issue or the event that took place. Next, we should include when it happened, so we understand the timing and potential causes related to that period. Then, it's important to mention where it occurred, the specific location or environment where the problem was observed. Additionally, we need to identify the batch, equipment, or system involved, so we know what part of the process was affected. Lastly, we should describe the observed impact, what consequences or effects resulted from the problem. Now, why is this so crucial? Because a poor problem definition often leads us down the wrong path when identifying root causes, or RCA. If we don't get the problem right, our corrective actions, or CAPA, might not address the real issue, leading to recurrence. This step, problem definition, is critical. It sets the foundation for effective problem solving and helps ensure that our solutions truly resolve the issue. Remember, clarity here is key to avoiding downstream mistakes and ensuring continuous improvement. When it comes to supplier and material documentation, it's crucial to ensure that all data we collect is complete, accurate, original, and attributable. This aligns with the ALCOA Plus principles, which help us maintain data integrity and compliance. We need to gather batch manufacturing and packaging records, training records, logbooks, and maintenance records to have a comprehensive view. Additionally, calibration certificates, QC test data, chromatograms, and audit trails are essential to verify our processes. Environmental monitoring data also plays a key role in ensuring our environment meets quality standards. Ultimately, the goal is to collect all relevant records. This forms the evidence we review during our data collection process. By doing so, we can confidently validate our activities, identify any issues, and maintain the highest standards of quality and compliance throughout our operations. Let's talk about how to effectively link RCA directly to CAPA actions. It's crucial that we don't jump to conclusions like human error without thorough evidence. Always make sure you've demonstrated that there was adequate training, proper procedures, and effective controls in place. We also need to confirm that no system failure contributed to the issue. It's important to challenge each suspected root cause with concrete evidence. Don't accept assumptions at face value. To validate the root cause, use tools like trend analysis, review historical records, and conduct system reviews. This helps ensure we're not just guessing, but really understanding what went wrong. Remember, the root cause should be actionable so that you can implement effective corrective actions. It also needs to be well documented and truly address the real failure mode. When finalizing the root cause, take a step back and evaluate all evidence carefully to confirm you're targeting the actual issue. This thorough process ultimately helps us strengthen our overall quality system and prevent recurrence. Let's take a moment to review some key takeaways. First, root cause analysis, or RCA, isn't just a good practice. It's actually a regulatory requirement. It also forms a core element of a strong quality management system, or QMS. When we perform RCA, it needs to be logical and structured, based on evidence and driven by risk. This approach ensures we're truly addressing the underlying issues. It's important to remember that before implementing any corrective or preventive actions, or CAPA, we must identify the true root cause. Otherwise, we risk just treating symptoms rather than solving the real problem. By conducting effective RCA, we can strengthen our overall quality culture, improve compliance, and drive operational excellence. When RCA is done well, it leads to fewer deviations, stronger processes, and ultimately, better patient safety. So, in essence, mastering RCA is essential for continuous improvement and ensuring the highest standards of quality and safety in our work. Let's talk about regulatory expectations when it comes to investigations. First, The U.S. FDA under 21 CFR 211.192 emphasizes the importance of thoroughly investigating any discrepancies that arise. This means we need to dig deep to understand the root causes behind deviations. Moving over to the EU GMP guidelines, specifically Chapters 1 and 8, they highlight the need to investigate deviations and complaints using root cause analysis, or RCA, to ensure we address the core issues effectively. In addition, ICH-Q9, which covers quality risk management, advocates for a structured, risk-based approach to analyzing problems. This helps us prioritize and make informed decisions during investigations. Then there's ICH-Q10, focusing on pharmaceutical quality systems, which promotes continuous improvement, again, through RCA to enhance product quality over time. The WHO GMP standards also reinforce this point by stating that root cause determination must be completed before implementing corrective and preventive actions, or CAPA. The key principle across all these regulations is that RCA must always be science-based, evidence-based, and systematically documented. This ensures our investigations are credible, reproducible, and aligned with regulatory expectations. Overall, these guidelines remind us that thorough, well-documented root cause analysis is fundamental to maintaining quality, compliance, and continuous improvement in our operations. For further support, please feel free to contact us. We're here to help with any questions or additional information you might need. Thank you very much for your attention and participation today. Remember, we're committed to your success, so don't hesitate to reach out. Thank you again, and have a great day.